Oh, can you untap this for me? Because it's not in that fine night. Thanks.
I'm gonna grab this stuff to open up. Don't wait on me.
Oh.
Yep. Work together with your team and get that open. So don't worry about drapes or anything like that to your field, okay? Just get up, get the tray, get it set up, and we'll go through a count.
You want me to grab your instrument tray there? Yeah, squatted. I don't have to touch anything, though. Oh, yeah. Sorry about that. Do you want us to go where Arthur?
So, yeah, I assume you did your surgical scrub. Yeah, if you contaminate, call yourself out, and then just I want you to get another one and get it on there, okay?
So you want me to?
Yeah, or you can just pretend. That's fine. No worries. I don't want you. So the question was originally, what was the original question? Again.
5.5. I don't see the third tray anywhere. Third instrument tray?
Really? Is it over here?
What? I'm looking for a third instrument tray. Is this it? No. There's that one, but it's
Yep.
other stuff.
That it has to be it, right? What you need?
The instrument tray that's on.
She's getting it right now. I think it was hiding in that corner. So are you setting up?
Yes. Are you just wanting me to get wet?
Yeah, that was the original. So yeah, just get a little wet and get in there. But remember, we need to make sure we do our surgical scrub first thing in the morning, right? Gotcha.
You want me to get one in a peel pack? Or
Yeah, so you can peel pack that, add it to your things that you're going to have to be opening up for her.
Okay.
So 2 10cc syringes, okay? One's going to be for local. Yeah, 2 of them. Yep. Coming right behind you. So, Celeste, I need some local open up to Haley's Field and also some lidocaine, and one of these is going to be heparin, okay? So make sure they have it separated. Make sure you guys have labels, okay? Or if you don't have the skid marker, okay? So some saline, some lidocaine. Obviously, one of them doesn't say heparin, but just pretend it's heparin.
That's what I'm going to do when it comes time comes. Gotcha. Copy that.
So you got this tray open, or are we just going to wait till... Is this your tray?
Sorry, I forgot to open that.
No worries, just wonder. So speed is kind of what I'm looking for. I mean, just be careful. I'm just pointing out, because you just can't came over like that. Little things like that. Just be aware of your
I
surroundings.
wasn't even paying attention.
Yeah, I know you weren't. Don't take it. I'm not. Yeah,
No, you're
just pointing things out. Beautiful. What are they?
Skin markers?
No, there's some in the back, right? No, you can use those, like, but yeah, there should be some in the back there. If you can't find them, they should have ones that have labels and stuff, right? if you come here and commit yourself, you can't come back.
Yeah, I
It's okay.
realize that.
No worries. Just pointing it out, my dear. You can get in there. Just commit. Is it upside down? Is that what you're concerned about? We're going to find out, right? And then when in doubt, ask for another one. You think you're contaminated?
Yes.
Ask her for another one. And just, I'll take that from you. Okay. And don't be ashamed of when in doubt, throw it out. They'd rather you call yourself out than trying to, how am I going to solve this puzzle? You're contaminated. It's not a big deal. It happens. The sooner you get over that fear of like making mistakes, the better you're going to feel. As long as you don't keep making the same mistake. Yeah. Because I'll respect you more if you call yourself out, right? And then trying to hide it.
Indicator's good, next. Thank you. No problem.
This got a little baby mini skirt. So I'm not sure what that is. Maybe even get a 3/4 sheet next time. Is that a half sheet or a medium sheet? I have no idea what that is, but we'll use it. But this is, it's like old.
It's supposed to cover on all sides.
It's supposed to get down here so you're covering. This is, realistically, this is what you should only touch. But let's say hypothetically I came rolled up like that. You see how this is all exposed and stuff? I'm not sure what this is, but try to get like a medium or a 3/4 sheet that covers the whole
That
edges.
was the makeshift room stain covers from that.
No worries. There's no judgment, just pointing out things I see. That if I see it, I know a nurse will see it. So, and these are things I've been yelled at about. Not yelled, but corrected. No one yells at me. I'm just trying. I had a nurse that just made me cry every day, but she built my confidence, and she was so right. She was from trauma.
She made you cry.
No, like in my brain.
Mm.
Like it was like I didn't do anything right, but she wanted me to learn that you need to have muscle memory and just quickly get going. We need to get set up. It's not about making it pretty. You can make it pretty as soon as she walks away or he walks away.
Okay.
It's that gather your sharps, get that tray ready, get her account, and then they'll go get, so they can go get the patient. And then you have a good 20 minutes before that patient's asleep. Because everyone wants to make the table perfect before they count. Nurses hate that. They'll sit there with a clipboard. Like some are just so nice. I've always been learning. Let's get that count so they don't be staring at me. Just get away, and then just organize it the way you want. Then you can become more retentive. But get the tray out, get the stringer out, gather your sharps, get that count out of the way, and then you can organize your mayo. That's beautiful. So this is your stuff that needs to be opened up to her, but whenever she feels like she's comfortable, but just so you know, all this needs to be over. Now, if it's something you're having trouble kind of getting on there, she can just open it and grab it.
Okay. Left. Whenever you're ready, for some of your bodies to just Okay. Wait, sorry. 1, 2, 3, 4, 5, 5 left. Right tips. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 retics. Cotton knives. No cotton knives. Needles. No needles. Blades. 1, 2 blades. Hypos. 1, 2 hypos. Bogey. 1 bogey.
Ready?
Oh. I need to ask for some cotton 6.5.
That's too small for you.
A little too big.
Too big.
But I have that
Spray person. You like the way it is? You good?
next, I'm going to pull it this way so one of my stuff is closer to the
Yeah, makes sense. All right, let's start with your Ratex.
1, 2, 3, 4, 5, 6, 7, 8, 9,
Laps.
1, 2, 3, 4, 5.
Any blades?
Nope.
Any hypos?
I got one.
Any sutures?
Nope. I got one bogey.
Can I just? So I'm going to point that out. I was always trained to do two things: have this preloaded,
Okay.
just one less thing, and make sure this is out. Whoops, without taking anything out. Yes.
Out like that. Okay, gotcha.
Right. There's two things. Obviously, you can just say when you're doing a count, they can see it, right? And so you don't have to go in there and fumble it in because you don't know you might have other stuff on top of this. So you really just expose and it's ready to go. They can visually see it. That's how I was trained. So because this, if you don't know, comes off, right? You do now. Now, do you like? How do you? Or do you like this way, or do you
For right
organize it?
now, I like it this way.
Okay, let's do it. Let's do a count. I want to start with your stringer from left and right,
Start my finger.
please.
Okay, I got 1, 2, 3, 4 first, 1, 2, 3, 4 non-first, 1, 2, 3, 4 speeders, 1, 2, 3, 4, 5, 6 Kellys. Well, 7, 8 Kellys because those are straight Kellys, right? And then 1, 2, 3, 4 Cokers, 1, 2, 3, 4 Alice, 1, 2 Babcock, 1, 2 right angle, 1, 2 console, 1, 2, 3, 4 needle holders. I got 1, 2, 3, 4 scissors and 1, 2, 3, 4 scissors.
Forceps.
1, 2, 3, 4, 5, 7, 8.
Okay. Retract it.
I got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Retracted.
Okay. Full section.
I got 1, 2,
How many selection in total?
1, or 2, 3 technically. 1, 2, and then 3.
Knife
right?
handles.
And 1, 2.
Point to the malleable. Richardson. Army Navy.
Nice off. What's over here?
Send.
Sorry.
The Volkman retractor.
What?
The rake.
Okay.
Yeah.
Right.
It's called a Volkman, but yeah.
Okay.
This is a rake. This is actually a Volkman, but
Oh, okay.
yeah, they're both the same. They just have different prongs. There's 2 prongs, and usually like under the Volkman category. But yeah, perfect. All right, good job. I like it. Did you count? I'm coming down. Did you count with it?
Yes.
I'm gonna come down and just verify. Yes.
Sorry.
No worries.
The tray is not the same as mine. Like it's missing something.
Oh, great.
It's not the, you know. 'cause it's
Good.
not-
So we'll try to correct it.
but,
Yeah, I'm not sure what happened. Maybe someone grabbed someone out of there.
There's only like one knife handle and other things like that.
Shame on Dr. T.
I think it was.
So you have 2 options. Either you wait a little bit and you come over and help us instead of watch the demonstration, or you can break and start breaking this down and when we're ready. But I'd like you to see when I go to how to set up the actual vascular tray. This is fine.
So right now you want me to break down what?
Yeah, that's fine. I saw what I need to see. I didn't see it last time. I think you did fine. Perfect technique. I can work with that, and it's fine. We're going to extend out from that. I just wanted to initially saw that. I didn't see you 2 yesterday or last week. Now, obviously, drapes in the order.
Now if I had drapes, yes, I would do my towels. Okay, I would do. So it's towels in 3/4, 3/4 towels.
So start from the top, which is going to be the first thing. What's on top?
Surgeon and gown
Yes.
and gloves
Alright.
and all that stuff.
Next thing's going to be
My towels are 3/4.
3.
I was told we were told towels 3/4 laparotomy,
Okay.
but I know last week you mentioned 3/4 towels and
Because that's what they're going to say on the test.
Okay,
You know, I teach the course, so I want you to think like CST.
so I would do
If they
the-
say something out in the real world, there's going to be a disconnect between CST questions and the real world.
yeah.
I want to be like, okay, I'm telling you, but I want you to. If someone says, "Hey, do it this way," say, "I want to try to do it this way because the CST." But if they're adamant, "Hey, just the preceptor, I'm going to show you this way," that's fine. But just realize there's a disconnect between what they're showing you and what the CST questions will be.
So the CST is
CST is
3/4 towels.
an assistant gown, their gloves, a 3/4 sheet, 4 blue talons, and a laparotomy sheet. And that's kind of how they were. They want you to structure it, right? That's all. But like you said, I know, I'm surprised Christy, but she should be teaching right out of the book. If you could, yeah. But anyways,
I was with Crystal.
oh, well.
I was that one group that got with Crystal.
It's, yeah, again, I'm not contradicting her. I'm just trying
We
to,
did a lot of like she went over a book on some things, but a lot of it
Yeah.
was like
yeah.
what she's seen because she's still out there.
Perfect. I mean, she has a lot of experience, and it'd be foolish not to listen to her, right?
So yeah, so that's
I would never ever crucify Crystal. She would probably come in here
She'll like rip you a new one.
and we started together. So yeah. All right, that was perfect. How did she do?
She did wonderful.
So, what instrument did you catch?
Well, on the other trays, there's 2 of these, and there's
So we're missing a 3.
8 of these, and there's only 6.
Oh, look at you. Okay.
And there's also the Kellys, I think, is what it was, right?
No, we do have Kelly's, but we don't have
the same amount.
So don't we have the instrument count sheets that Chrissy made? We should have them all in the trays. Why are they not there anymore? Is that my fault? We'll have to figure that out. I'm not sure where your container went. Oh, is it 2? So anyways, looks great. I was watching you count it out here and then set up. Either way is acceptable. How did you feel? Yeah. Okay. So we will check this before we go, and we'll make sure that we're missing something. We put a check to it, and after class I'll fill it in. Okay. So I'll put it down here. So go ahead and set your mail up. Okay.
Just leave it. Do you want us to take
I want you to set your mail up. Yep. I'm letting you do that because I want to see your mail set up. Okay, you're going to do it my way, or you're going to do it your way, whatever you feel comfortable with at this point. Okay, it's no judgment. Just for an open belly case, set it up like you're going to have a variety of things on there. Okay.
We need another coolie.
You need another coolie?
A lot. 1 bell.
1 fell. We'll just use that same one and pretend it was just a peel pack and just rewrap it. Where's the coolie? I'll grab it. There it is. Yes, ma'am.
I'll grab it.
Ow.
You said you're gonna.
I want to help you.
Okay.
Yeah. I'm out. I'm just making sure everything's open. Okay. Sorry, I'm dancing. I'm dancing. I hope not. Looks real.
It looks real good.
I wouldn't touch it. I have no idea why that's there.
Sorry.
It's crazy. Are you fine?
Oh, and the peel pack.
So when you open these, there's a kind of a wrap or thing that would be, not the wrap, but it's kind of a seal. That's the word. You'll break that seal. Oh man, it's so old.
Cheese cream.
So obviously the seal is not broke yet.
Oh.
It's like a wine bottle. I'm just checking it doesn't pop like that. No. And then in here is sterile. So if you can hold your basin to me, like you reduce irrigation, and then they will.
Okay.
And that's how that's done.
Keep this.
Yeah, because we'll put that in. So those are, you should know what that is, right? So is everything open?
Almost.
Are you ready for some medication? So how many we have of these? Just 1?
Yeah.
So we're gonna get, actually should have 2 in here, right? So this is gonna be for your saline, and this is gonna be for your heparin. Do you have labels? Make sure you label it when she gets it to you, okay? So,
Can you give me more labels?
Where are the labels?
In the cabinet up top. Next one over. No, actually, next one.
take your time.
I don't know where they are.
I will get them. That coolie's on your tail. It needs to be opened up over here on the patient. Oop. Took me a minute, but just to organize
She
that.
organized everything to go different. You got these for you? Okay.
As you do, Frankie, you do, right? Did you set up last time? Okay.
Yep.
Good. So eventually everyone's gonna re-scrub and come in with us, and we're all gonna kind of rotate a little bit. But then, I'm letting Ariana do that so I can see her set up too. But and then we can all rotate, and we're gonna watch that basket case. Should be fun.
I got one more.
There you go. I was wondering when you open that, Drake. Don't forget the IO band too.
Yep.
Please and thanks. You got a down sheet too.
What?
Do you have a 3/4 sheet?
That's on the way.
Well,
all the way
that's a
here.
thyroid sheet. But Drake, do you have a down sheet?
Oh my God, make it down sheet, please.
Thank you.
Right in
That looks like my setup. Do you feel comfortable with that, or
This is wet.
then that's going to be the key? So
Yeah.
perfect. So here, if you grab yourself, you don't have an extra blue towel, but if you had an extra blue towel, you can fold it and kind of lay that on top of it. It kind of provides a little protection because this is so easy to go like right through it.
Mhm.
So having an extra little, if you had an extra blue towel, I would show you, but you just go back to where it was originally wrapped. There you go. And just kind of fold it in half. There you go. And if you lay that down, and then you can just, that's a little bit more protected.
Okay.
So
So
it's
sharps.
sharp hit. I typically put the sharps there, so if it does go through, it's not going through the table. It's going through like right there.
Medium.
Otherwise, this is perfect, right? That's how I would do it. Are you comfortable? And obviously, I'm going to show you maybe if you want to add some ties off to the side. Another thing you probably could do if you want to anticipate, you don't need all these all at once.
Okay.
I would just probably have two, if you want to use two just to start off with. And then another thing too is if you have a lot of sutures, you can probably put your suture box right here. Meaning, if I don't know if you know about that, but this comes off and then you can just kind of stick it in there, but we don't want to do it. Also, this has stickies on the bottom. You tear the stickies off and you can just paste it down. It's not going to move.
The grip.
For grip, right. So I usually put this on my mayo sometimes. So when I'm suturing a lot of things, I don't have to go to my back table. I just put it right in here. And do you know about the numbers? So when you get a suture back, you put the 1 in the 1. You get another suture back, you put it in 2. So it's organized for count wise. Otherwise, this is perfect. I like it. So just chill out for a minute.
Alrighty. Ready for count? Yes.
So we need to count all these items. Are you going to do that for me?
Good. Yes, sir.
Okay.
Alright, ready? Yes. Laps.
Should we do meditation after we count?
1,
Yeah, it's fine.
2,
Just focus.
3,
It's a lot of stuff to count.
4, 5 laps. Latex.
Come on over, Marianne. Watch.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10 Ratex. Cottonoids. No cottonoids. Needles.
Hypos. Or
1.
we're going with hypos first, right?
Oh, hypos.
Or you want needle? Okay, sutures. Sutures? Yeah. Sutures. Sorry.
1, 2, 3, 4, 5, 6. Are these counted? These are ties. Right?
You don't count ties? Good. So what I want you to count, so if you're the nurse, I want you to, do you see it?
Yes.
So don't just say, you need to literally say 1.
Okay.
You know, at least if you're looking, right, you can 1, 2. So go ahead and do it again.
Push your hands down, pick them all up.
But if that nurse is halfway across the room, whatever, just say, hey, 1, so they can see it. So, because if it's a redundant system, it's like if they're oblivious, that's one thing, but you're making an attempt for 4 eyes looking on it, right? Because believe it or not, if you're missing one, it's going to fall on you, right? Typically, so I'm overprotective. I want someone to watch it because I know I'm half blind. So
If they're done, just make sure you count.
So let's restart. Needles. 1, 2, 3, 4,
it's okay.
5, 6.
So here's the deal, which we're trying to allude to. You did great. So these are ties, right?
Mhm.
These are ties. These are ties. We don't count those. There's no
Oh.
need of. So, but when you're counting these, do you see how they have 2 in here?
Yeah.
So you need to count, like, say 1, 2, 3, 4,
Oh,
5.
that's okay.
No worries. And also make sure you look in it because believe it or not, sometimes there's 3 in there. So make sure you're both seeing that. So go ahead and count one more time just because we want to see it.
My needles.
1, 2, 3, 4, 5, 6, 7.
Outstanding.
needles. Perfect. Blades. 1, 2 blades.
All right, hypos.
1, 2 hypos.
All right, and Bovie.
One bogey. All right, awesome.
So does anyone want to tell me my pet peeve about bovies? Just turn around, make sure it's exposed. You wouldn't even have to pick it up if you just have it out. Then you just say bovie, you can see the bovie. Just saves you little times of moving like that. If you can eliminate little spaces like that in time, it goes quicker. Okay. Little things like that.
I have one question.
Yes.
Is she gonna need another needle though? If she's drawing up 2 different types of medication, or does that matter?
So in this case, let me just go over what did we draw up with.
We haven't yet. But we
Okay.
have the
This one,
HCH.
big one.
Okay.
18.
So we know it's a larger gauge, right? And we know it's a smaller gauge for injection purposes. She's just going to draw both with one, just because for time purposes, as long as you know. Because typically in the real world, the way we're showing you by you standing here and I'm drawing it up won't ever happen. I'm telling you, most nurses will draw it up themselves in a syringe like this. Say, give me your cup. You'll come up to the side and they'll just squeeze it in.
Are they gonna use different needles?
They're trained. It's their job.
Okay.
If you want to correct the nurse, hey, did you use a
I'm
different
not correcting her.
I probably won't.
I was just questioning. So
Yeah, there's filters needles. There's obviously different needles, but their needle drawn up into their syringes, obviously they're training, but they don't want to go through that part where you're holding it and they're drawing it up. But the thing is, don't let them come over here and go like, all right, take this and go like that, so they can just squeeze it in there like that.
gotcha.
And that goes for the irrigation too, because you're gonna have a lot of them just say, hey, just put it up against the table. I'll come there sooner or later. And so I'm working, I turn around and suddenly it's there. I'm like, did I even verify anything? So this is part of your be professional. Say, you know what, just let me know and I'll take it over. Don't say, hey, get off my damn table, because a happy nurse is a happy life, right? You want to piss.
So what do we do if they actually do that to us? We're under externs, they fill something.
Externships, you're not going to say a word.
Okay.
You're going to go on the preceptor.
Okay.
When you're hired somewhere, there's proper things to address things. During surgery is never a good time. Get it to your field, it's fine. You find that there is some kind of contamination, let them know. If you don't like the process, talk after the case.
Okay.
You're developing relationships. So, you know what, I just prefer you if I have my cup because I think it's a little safer for everything for the patient. If they say no, well, then you can talk to the charge nurse, the director. They want to play that game. But it's about building relationships and not trying to be like, it's my way or the highway, but it's all about the patient. And I've just seen a lot of things. It's bad habits develop over time, and I'm just as guilty of certain bad habits because you want to go with the flow. And all of a sudden you're like, well, that's a little easier, and you just kind of go with it, or you don't want to make waves. Externships, you're not doing any of that.
Okay.
Right? You just go with the preceptor. If they say something, just kind of go through them. Or ask them in a general, is that acceptable, you think? What is your normal thing? I was trained that we need to be away from the field, and let them give a kind of an explanation. It might be wrong, it might be right. Just kind of see what they say.
So if they come up and put stuff in there without you knowing, and you don't get a chance to label it,
That's a bad thing. In externship, go for the preceptor.
Just go to her and tell her or ask her.
When I say preceptor, working together, say, hey, I didn't check the expiration. What you can do is say, if during the case, just say, hey, can I see what the expiration is on the lidocaine and check the strength? Because you have to label it. Mm-hmm. They should never ever get rid of the actual medication. It should always be over on a nurse's station. Over with saline, everything that they put on your field should be there for you. You have every right. You forget what they said. Hey, can I see that real quick?
Right.
But it's how you word it. It's like, hey, I didn't see the expiration. Can you bring it to me? Like, screw you. If you're the nurse and say, hey, Frankie, by chance, can I see the expiration? I just didn't see it. Use it in a general term, even though you're in your mind like, hey, man, you just snuck it on my field. You get more bees with honey that way, right? You just accomplished getting what you wanted, but you didn't really put them on the spot. That's how I work.
Just to clarify, in this situation, you want us to go to our preceptor and say, hey, I didn't see the expiration, and let her do it, or talk to him, or we can talk to him.
It depends on if they want you to do that.
Okay.
Yeah. I want you to get used to being a part of the case, but I also want you to kind of check with, if you, let's say I'm your preceptor, and I say, hey, just let her know.
Okay.
You know, if they say they can sense the room is a shit show, let them deal with it, right? So that's what I want you to do. I don't want you to think that you can't do anything, but always just check with that person you're with, because they know the surgeon, they know the nurse. They say, you don't want to mess with this nurse.
There's just a fine line between doing it right then and there or afterwards. In
Well,
this situation, you do it right then and there. You go talk to your preceptor and see what she wants to do about it.
It doesn't hurt. I mean, I want you to get used to just talking in a professional way. Let's say if you're put in a situation where you have to talk to a nurse, as long as you're talking to them in a professional way, if they come back to you with a little aggression, just kind of go with it. You know, I'm sorry, no problem. That's one way to get used to that, because there's no silver bullet, no right answer that I'm going to tell you that this can happen, because anything can happen, right? I don't want you to just sit there like not say anything. You know, if you know something's wrong, that's good technique. I also don't want you to make huge waves either. Does that make sense? Okay. So what do we else? We count accountable items, the basic counts done. Now we need to count things that are part of the vascular case. And I'll show you how to set this up. But now vessel loops, I would take all these off. You can get rid of this and just lay them in here. Right? We're going to lay our Jobber shunts here, but lay all your vessel loops just kind of in here. Mm-hmm. Now, before we do that, can you get some irrigation to the field? And we're going to get your medication, and we'll continue this part of the count. But let's get this to the field first, and I'll tell you why. So irrigation.
So you want it in here?
So where do you normally put irrigation? Yeah, there you go. Yes, ma'am.
If you're putting your vessel loops on that,
That's my whole point.
sorry. Okay. Sodium chloride, 0.9%, expiration 625.
Yep. Did you see that?
No. Sorry.
So I was always trained at this, right? 0.9 sodium chloride. Expiration date is 06/25. You need to repeat that for me.
0.9% sodium chloride expires 6/25.
Right, you agree? All right. Cap and obviously pour in a continuous flow. Don't stop, go, because if you stop, you can contaminate. So obviously we probably are not going to fill the whole thing up, but you should never recap that. Once it's open, you use it or it's thrown away. But in this case, just fill out until you can get maybe about 3/4. So nurses say, do you want to have all this? Usually you want all of it.
Right there.
A little bit more. Yeah, it's beautiful. So never recap that, put that on the nurse's station. So back to the vessel loops. I would take the vessel loops off and put them into the heparin saline or saline mix. So take those off. But when I do them, I'll take them off. Oops. There's one. And these are countable items. I just don't throw them in there. What I'll do is I'll lay it in there and I'll lay it like that so I can literally count them when I go around. Okay. Why are they in the irrigation? We need to make sure they're lubricated when they come to the field. You can't have something that's dry and rubbery go around a vessel. It's going to be kind of traumatic. So vessel loops, umbilical tape, no, but definitely vessel loops. Now you can have the red ones, you can have the blue ones. Obviously, I put them all in the. Also, could be heparin saline mix. So saline and heparin. What does heparin do? It's blood thinner. So again, if you have it, you keep putting them in the heparin, it's going to help reduce clots building up on the vessel loops too. It's going to keep them from little blood stains. So you can get rid of that. These, if you had you have those suture things, but obviously in the garbage. Sometimes I use that suture little bag as a garbage bag. I just kind of throw it in there, but. Or give it to your nurse. I want you to clean as you go, so get it off your field. Yeah, we don't need those anymore. So these are suture boots. Mm-hmm. You guys can come closer if you want. This is more of an in-service. So again, these have little kind of tape that you can actually stick these right to the table. Get enough time or labels and pullers to last the lifetime. Mm-hmm. So I would stick these here. So good. So then we have one for local, right, hypothetically. Mm-hmm. We're going to take this off. Which one's for injection? Have you got your local yet to the field? We're going to get it now. So let's get our local.
Shoot. Okay, lidocaine with epi, 1%. Expiration 10/25. You see it? Sorry.
Yeah, okay, lidocaine with epi, 1%.
I changed the date.
Expires 10/25.
So, can I-
like this?
Can I show you?
Yes, please.
So this is why nurses don't like it. So I was always trained to hold it like this and then hold your hand for kind of stabilizing it because you're. So again, also on here, pull back on that plunger and then go in and then push up a little bit and then let gravity kind of do its work. Now this probably has 15,000 holes and you probably will have some drippage, but that's.
So I push it in.
You'll say go in there first. Don't hit my hand.
Not.
All right, I'll pull, just push all the way up. It's going to be drip, don't worry. It's just because it's got thousands. Now let gravity do its work, right? Come back on it. That's good enough. And that's obviously, it's just been stabbed thousands of times. Lidocaine, epinephrine, 1%, right? So make sure you label that. How do you label it? The strength-wise, is it just 1%, or do you write 1.0? Yeah, 1.0. So make sure you add that decimal. If it's 0.25, you want to write 0.25 so they don't confuse the. That's on a CST exam. They want you to use that decimal for labeling. So heparin, do the same thing. Just pretend on this one.
Do I pretend the percentage too?
Yeah, we're not going to
So
go
I'm
right.
not actually drawing it?
Well, heparin is. I just want to make sure we're not going to do this part, but heparin will be added to your field. We'll put it into that small cup, and then eventually I want to have a little heparin added to our heparin saline mix. The percentage I'm not going to go over. It's like 5,000 to 500 ratio. I'm not going to go down that route because my brain will blow up. I just realized there's some heparin to the field. We added it. So did you label this?
No.
Label it heparin saline.
So why would you add additional heparin if that's already a heparin? Didn't you say that already?
No, I was premature on that. Typically, they'll add the saline first. They'll mix the heparin up, and then they'll add it to your saline.
Okay.
And now you might have saline and heparin saline.
Okay.
But in this purposes, I just want to have heparin saline because I don't want to have all that stuff on the field. And it usually that needs to be labeled properly. And if you don't know the percentage, let the nurse know. And it's usually like 5,000 to 500 ratio. It's typically they're mixing it back there. This is why the nurses have a little bit more, on their license, more responsibility medication. There's a lot more mixing. We don't want to be messing with heparin unless you're trained in that because that can kill someone. Now we can have that systemically by the anesthesia pumped in, and obviously this is for flushing. So is there a heparin? So you can take that syringe or that hypo off, put it there. No, I'm sorry, do the other one. I'm sorry, my dear. All right, good. So now I want to, where are the heparin syringes? So these syringes are hypos, or what they call heparin needles. So attach this one to that, right? Let me see, hold on one second. Sorry, put that onto that one. Yeah. Switch this needle over to that, so that's for injection purposes.
So technically for count, we should be 400.
Well, we haven't gone through the full count yet. I'm just getting this ready. All right, so get that under there and put it right here for me. So now we're going to continue the count. So obviously irrigation, all this stuff should have been added beforehand. I just want to make sure it's on the field. So now let's continue that count. What else is a countable item? Oh, God. Go distract them for me. So vessel loops. How many vessel loops do we have?
1, 2, 3, 4 vessel loops.
So the umbilical tape I want to have so I can see it. So how many umbilical tape do we have?
1,
How many suture boots do we have?
2, 4, 6, 8.
Who do we appreciate? No, go ahead. Suture boots?
2, 4, 6, 8, 10, 12, 14, 16, 18, 20.
20. How many blocks do we have, or boats?
1, 2.
Okay, good. Do we have any Rommel hook pieces or Robinson pieces?
1, 2.
1, 2, okay. Any bulldogs?
1, 2.
Any hypo? Can you tell me give me the hypo count one more time?
1, 2, 3, 4 hypos.
So +2 on that hypo, just hypothetically that we made a mistake. Okay. Good. So what I want you to do is, obviously on your mayo, I'm going to help you out a little bit, okay? How many pieces of Java do we have? Java shunts. So anything that's small and can get lost, you want to have a countable item to it. Are we going to count the tray? No. Why is that? Because we're not in a cavity. The only reason you would count a full count, you're in the thoracic, abdominal, pelvic, cranium, only in a cavity, right? Typically we'll count everything. Since we're only in the neck, and if I lose this in the neck, get out of that hospital right now. So, well, hey, how you guys doing? You guys want to be the patient? No, okay.
You Instructor Brad, she's
Yeah.
joining us for September 30th.
Oh, well, welcome. Oh, that's Georgia. Yeah, I heard Georgia on your mind this morning as I was driving in. I was thinking of like Georgia. Well, nice to meet you. So let me help you out with this field. So let's fill these up with some heparin. So you can come in here and just right. Yep, back there you got the count. That's fine. So make sure you label these heparin saline too.
Okay.
And fill this one up. And then we're going to set this field up, okay? Now, have you guys, as she's doing that, have you guys learned how to do ties before? Can I borrow one of your blue towels back there, Marianne? So we have different ties, right? You guys can come closer. You seem so far away. Is my breath bad or something? Probably is.
Stay away from the stairs.
I know, we're just in a timeout mode, so come on over. Yeah, we're just going. I want you guys just to see this. So, tie on passers, right? I like this one. All right, so we have silk ties, zero ties, probably a common thing when we use that, probably not an infection, right? I think this is a vicryl tie. We're going to use the silk ties, right? Different types of silk tie, but typically this is both zero, which is just a larger type of tie. So how? You were never shown on that. So you can either have two ways you can do that. Leave it right in here, but that's not how I like to do it, because then you can have these up here and use these free ties or ties on passers, but I'm going to show you how I do it. So I know I have this. Wrapped weird. So I know I have this, I can put the ties in here and then close it up and then label these ties. So these are silk ties. Do you have your scissors? You can take the stringer off, please. Now, these are large, but we know there's zero ties on here, right? Well, that's what we're going to use for this case.
You did brief stations on them, but not confident.
No worries. I'm just showing you the way I would do it for this case. And again, preceptor hopefully will show this to you during every case. Ties can be used for vessels. Obviously, in this case, we have small vessels. We also have clip-up pliers we can use. But I want you guys to get used to setting up, just having ties available if you anticipate bleeding. Because sometimes doctors like free ties, just tie off stuff. Okay. So I typically cut this right in half. The other scissors sharp. So just cut like right on the edge there. Get in there. Oh, right there. Good. Good. And put this in there in that garbage. It's like your dead ends of your hair. Good. So I can do it. Shoot. Fold that up for me again so I don't lose it.
Hold it.
Just where it was. There we go. So open that up. So good. So now I just lay that in there. So based on the size, right, that's a medium size. A little bit large tie, right? So cut it right there. Right there. Okay. Just that out your field to some random person. Now close that up. Okay, good. Now I can then I start thinking about how my mayo is going to go. So we're looking at my crazy looking carotid guy here. So when the doctor is working, a lot of the time the doctor is working at the head, right? Or he's working right here, and the assist is going to be like right here. So sometimes he'll move this table and unlock it. Man, it's old. They'll move this table, maybe. All right, doesn't move. But anyways, we'll lock it again. they'll move this table so they have better access, or anesthesia is not like right in the way. They'll have the drape kind of going over this way. The assist is here helping out, and the doctor's right here, and you're literally right here. So you ask yourself, well, that's going to be awfully hard to pass things, right? Yes, that is true, right? You're going to find out if you can do it right. So what I want you to do is, for the time purposes, how is this Mayo going to come? It's going to come right here is where your Mayo is going to be. So we want stuff facing that way. So if you turn this, that's going to go that way. So where would I have this is, can I change this? It bothers me. So,
So sorry.
no, because it's up. So give me another blue towel. You have another one? No? So you wrap this up like this. Smooth that down really good. Spin it. Get this as close as you can to the edge. Get all that craziness in there. Smooth that down. I feel better there. Now I have two things why this can do. I can put this towards where that Mayo, it's the other way around. The Mayo is going to go this way. I want to put that towards where I'm going to put. So there, just in case you need a free tie, you can grab it. Get it to them. Now, can I have a tonsil clamp? And I'll show you a free tie. Now, another thing too, if that was 0 ties, 0, right, ties, marker sucks. Now, if I had another one like a 3/0 tie, I can put it on the other side, label it 3/0. So sometimes doctors go back and forth. So if they ever need to grab this, they can just grab this right out of here, right? Free tie, give it to them, right? But a free tie, you don't know, got it? That's perfect. You guys know what a free or a tie and a passer? Oh, I apologize. Have you did it before? Anyone?
Briefly.
Yeah.
A couple times.
So I usually put my right on my finger and just get right on the end there. Can we do it, Bradley? Bradley. Every tell you time I did a whipple. I was so nervous doing this one time. So not the best in the world, but typically, why are we doing that? Why is it? Yeah, that too. But basically, if they want to tie in a passer, they want to have something so where they can go around with the instrument and grab it with another forceps so it can go around something. It's a tie, you're passing it, tie on a passer. So I would have like maybe 2 of those ready to go, or just 1. I like to have 2 so they don't have to wait on me. You know, I use that 2 principle where give it to them. I have one as if he needs one right away. If he gives me an instrument back, it gives me a little time to load it up again. Instead of sitting there like, you think I'm joking. So, so there's a lot of ties here. We're not going to use the rest of these, but everyone can practice with that. But that's how I would set on this up. Be careful not hanging over too much. So now the Rommel hook, we'll put the Rommel hook up here. So we know what that is. We'll put the umbilical tape somewhere near it because we know it's going to be used for that in some scenario. But I also want a 2. Did you open up the self-retaining retractors? Can I have the 2 self-retaining retractors up here? Can I have a Metzenbaum scissors up here? At least 1, that's good. Can I have 2 mosquitoes with suture boots on? Then put them on the, you have no mosquitoes whatsoever.
I have no Kelly.
You just, interesting. Can you get suture boots on? Do you have any mosquitoes on yours? So when you do these kind of types of cases, we need mosquitoes, and obviously your tray and a vascular tray would have a lot of them, okay? So load those 2 suture boots up. Everyone come watch or load that up, because this is something you guys should know. You want to get that on as early as you can. Again, they have these little stickies, and they won't move around, but it's gone, it's lost. So, all right, good.
Yeah.
So when you're on there, everyone feel this. See how it's not on there all the way?
Mm-hmm.
So try to push these on as far as you can. They seem like these are a little big. Okay. And we'll put these on your mail. The other one's there, so lay that on your Mayo. Remember to lay it not on a towel roll, just kind of flat. Punish me. Lay that on. Okay. They're not going to go all the way on. They just seem like they're a little bit bigger than the other ones. But as long as you got them on pretty good. So lay that on the Mayo, 2 of them. Yeah, beautiful. Load up the numbers. Do you have an 11 blade? No. Can I get an 11 blade, please? So as we wait for that, we'll put the 2 heparin saline syringes in the very back. Those are for our flush.
On the Mayo?
On the Mayo, yes. Just lay it in the back somewhere. That's perfect. I want to lay the Cooley clamps up there. So lay these together. Lay the Cooley clamps going this way. Flip them around. There you go. So do we have the Bulldog clamps?
Mm-hmm.
Good. 11 blade. We can load that 11 blade up. You load with the knife handle, right?
Yeah.
Okay, just making sure. I'm at a needle driver. You guys learn that? Load with an, okay. So-
Yeah, but I don't
Right here.
Oh.
Okay. No worries. Doing great.
see that.
Good job. Beautiful. Okay. So we'll get that on your Mayo. We're going to need that for the teriotomy. Not sure nothing on that. I don't like the way that's all by itself. But anyways, we're going to take one blue clip applier and one, or just give me the white clip applier because we only have white boots. Can you load a clip on there for me and have it ready on your field? Good. Is it on there?
Mm-hmm.
Lay it on the back table or on your Mayo.
I don't know where.
I'm coming over to help you. I just can't get there. I just want you to get it on there. So, okay, good. So, do you have another towel, please? And make a small towel roll. Actually, we got one. So, what I want you to do is these Bulldogs, we'll clip them right here so we don't lose them. And if I ask for them, you know where they're located. I want the Java shunt clamp up here. So, we'll lay this. This is going to be probably about right here. And I'll get, so you're not in the way. I'll lay this here. So lay this Java shunt anywhere you want. That's fine. And then this is a profundant. We'll lay out these 2 Sitensky clamps up there right next to the Cooley and going in the opposite direction. That's good. This is a profundant clamp. We never really went over that. We'll lay the freer up there. And we're going to lay this towel roll. What I want you to do is make that as tight as you can and then lay the rest of these just kind of on here like this, okay? Even with these.
Yeah, all these?
Not right now. All I want up here is the vascular DeBakey. And I think you had one on your tray here, hopefully. No?
Yeah.
It's a shame. So we're just going to go with the Gerald, okay?
Yeah. Using this one.
I got it, yeah. I don't want to confuse it anymore. That looks perfect. Or almost how I would set up a carotid. It's fine, I'm going to just use that Gerald. I don't want to confuse the trays. But vascular is the most common thing used in any time, or DeBakey's are the most common forceps used. You guys recognize a lot of this stuff up here? Yeah, pretty simple, right? So when you do these cases, you're not setting up crazy, right? You're setting up 4 steps. We're going to make an incision. Maybe you want to get that pot scissors up here right next to it. So grab one of the pot scissors. This is just a case of bleeder. So we know there's an incision. We know the extension of the incision is with the pot scissors. When we put the Java shunt in, we know it's going to use the Java shunt clamp. When we get to the tourniquet, we know we're going to give me the umbilical tape first, and then hand me the tourniquet. You're just listening to the doctor. If I ask for a Cooley, you give me a Cooley. You ask for Sitensky. These are for, look at that thing. It's crazy.
Right.
I know, I was a view is this weird looking. So if I ask for any kind of clip applier, give me the clip, I'll clip it, and then you got to reload it. These are fully ready to go. So if you want to put these right here and you're comfortable in your field, you just boom, load it up, lay it down. But when you load it up, make sure you choke up on this. You don't drop that. And if we had another white one, we can have 2 of them, but we don't have that. Most common scissor good used, obviously for blunt dissection, is the Metzenbaum. 2 self-retaining retractors. As soon as we get down, everything opened. Taking off the plaque is with the freer. Flushing out the irrigation with the heparin saline. That's what we're going to do. So draping, we have the thyroid sheet. Now what I want you to do is cut this to about this size. So just use your straight mayo and just cut right here. I think I laid it somewhere. And then I'm going to have, I'll come in and drape. Who wants to come up to the field? Does everyone want to gown in? We'll go to the field and we'll do this case together. It's 11:16 already. Holy menage. Yes. Yeah. Are you sweating? All right, you can break if you want. Not if everyone just wants to watch and come up and break, that's fine. I want 2 people to go with me. I need an assist. I need to scrub. Are you okay with staying with this? Are you okay? You guys, you can.
I mean, either way, I'm gonna have to deal with it. It's just right now I'm fine.
No worries.
But either way,
I don't want you to faint. So I'm going to come drape with you. So if someone needs a gown myself, I'm going to get you a gown and if you want to grab me a gown and like that.
Gotcha. What do you need for gloves?
That's it. That's my gloves. Okay.
That's
That's perfect. Yeah.
Can
Good.
you take pictures of it? Are you gonna wet your hands or not?
So you guys, I'm going to no, I'm just going to come in. Yeah, just gown me.
Can you take pictures of this?
The other thing too is having these loaded too with the Castro Viejo.
Thank you.
So when I'm getting ready, I want you to quickly make sure this works. Can you close it? Can you open it? Can you close it? And then preload this. Okay, and then just have it somewhere where it's ready to go. Let's get this profundant out of here. We're not going to use that. This is for irrigation, so we probably want to have that ready to go up there too. Not irrigation, local. And then load this and just have it ready. So I asked for a suture. So look here, I got closing the vessel, anastomosis, sewing in a patch. I have for the skin layer, maybe the muscle that runs across there, and then I have the subcutaneous is monocryl. Really large, but they're the only ones I have. So monocryl is typically for Ethibond I'm going to use. So if I ask for one of these, just make sure you're ready to go with that. And this is loaded up with a regular type of needle driver. Now, well, you got that? Mm-hmm. Yes, ma'am. All right, I'm coming in. I'll be back tomorrow. We have so this is going to be passed off. Great, all this is going to be passed off. Someone needs to play anesthesia for me. You got it. All right. Any questions? Is that too much? It seems pretty straightforward, right? Pretty impressed. It's been like, but you handled it like a champ.
So Bradley, you said this is almost how you would do your setup. Why only?
They're missing some retractors or some self-retaining retractors that are typically used. So yeah, it's about 98% accurate the way I would do it. These are typically not the typical hypo syringe or heparin syringes that are used, but I'm just using them as an example. There are some like that. I use disposable ones. I don't use these repurposed ones, but it's little differences. All right, you ready?
Yep.
Introduce yourself.
Hi, I'm Natalie. I'm gonna be your assistant.
Nice to meet you. Haley, thank you. Celeste, you okay? Is she okay?
She just needs to.
Okay, no worries. Can you pull my hands down real quick? Yeah. Just wash her. Pull that one down for me. That's it. So make sure when you do that, make sure your thumbs are either all the way in or all the way out like hitchhiking. So as far as you can out, right? Get that. Could someone tie me in, please, and thanks. I'm just an animal. So did we get a 3/4 sheet or no?
Yes.
I'll have that first. So in the doctor's draping, a lot of these doctors like to drape on their own. Grab that. Grab the other side. Come all the way out. Just drop it. Okay. Can I have the 4 blue towels? Good, I'll take the first one. So if you guys want to come, don't worry about being contaminated or anything like that. I want you guys to see this. So again, you want to do, the whole idea is to expose what? The incisional side. Is this accurate? No, it's not. It's just Brad trying to give you the most accurate. He's got a goiter. So the key is to, for a carotid, you want to make sure the earlobe is exposed. So the first one typically is to, no, I don't. I tried yesterday, and Chrissy thought I was breaking his neck or something.
But typically they're having.
Typically, it'll be a little bit turned now. Yes, ma'am. Perfect. In this case, you want to come here, be aware of this, right? You're coming in, and again, it's going to have an airway or an advanced airway, but you want to make sure, you can go back a little bit, that the earlobe is exposed, right, to the carotid. This is going to give them an anatomical position where that carotid is going, right, typically.
So that's the only reason why you have the earlobe exposed.
Exactly.
So they know exactly where they need.
Doctors, when they do the measurement, they see an earlobe, they know anatomical, the carotid internal is going in a certain direction. I was just always said, make sure I have the earlobe exposed, right? But then I looked up, that's exactly why they are. So obviously then you just want to fenestrate around, right? The incision. I forgot one other thing, I always do. So typically they'll have a scrunchie. Do you have more of these, or just?
We'll see for me.
So go ahead and get another one. So before you do all that, typically they want to get underneath here. Now obviously this is not accurate, but underneath in that gap. It's going to do 2 things. One, it's going to prevent pulling of the prep, but also when it bleeds, it's going to prevent them having blood all on the back of their neck and stuff. So it's kind of a rule of thumb. Do a scrunchie first, earlobe, and then you can come in closest to you and try to make a fenestration the best you can, right? Again, sometimes doctors want to prep from the nipple because God forbid they have to go up in this area here. They want to have that prep. So typically they'll prep the neck up to the earlobe, kind of all the way to the nipple, kind of going that way. So rule of thumb is just go where the prep line is. Sorry. Perfect. So now I'll have some of the Ioban. My glasses, or just
Push them out.
yeah. So you're gonna do it together for me, okay? Have you guys did Ioban before? So there's kind of a two parts to it. One, I'm going to pull on it, and you're going to push down on it. So come on up, and you hold this part, and you're gonna pull back on it, right? And I'm gonna come down. Oops. That's terrible, really. Just go all the way down. Perfect. So trying to get air bubbles out of it. Don't do that on the field, that's awful. But anyways, Ioban, what's Ioban for? What is Ioban? Incisive drape. What is it? Ioban. Going once. Going twice.
For like extra protection?
It is. Very good. To go with your instinct, right? So it's impregnated with what? Aseptic. So it's impregnated with iodine. So it's Ioban, iodine. It's also called an in situ drape or a type of incisional drape, right? But anyways, that's this extra layer. It's preventing any kind of bacteria. It's constantly giving antibiotics or microbial, preventing the infection getting into the wound. Thyroid drape. Ready? So take the stickies off on me, please. So this is really just a thyroid. Obviously, if you do thyroid cases, you can use it. But it's also good to use it for Can I see a straight male real quick? No, never mind. So how do you do this? Very similar to if you're doing abdominal. You find the center point, and you let it out. Push it this way. Who wants to do it with me? Come on over here, Mariana. Grab this. Don't let it drop. Back a little bit. Ooh. Pull on it.
Maybe you can't pull that hard.
So this you can always ask anesthesia to kind of move this back so it's not so wonky, but this probably you can move that out, but that's fine. You don't want air pockets. So if you're the assist, sometimes this gets in your way. That's kind of back in this way like this. So then you're like helping the doctor while the doctor is right here. So you're probably going to be standing here with me so you can come around, but you're going to start bringing your stuff out. Okay? And start help her pass the stuff off, okay? That's the Doppler. Doppler is going to be passed off the anesthesia, the M part, and make sure it's clamped down and tied. So use this as kind of a weight and bring this right up. Start putting the light handles on. Did Brad put that up there? And just, Natalie, just make sure you're comfortable. Get your table up. You can make sure you can reach things. If you have to adjust, can you reach the vessel loops? Can you reach everything? We're not going to do that. So basically, we're just going to work off here in your nail. Okay.
How would we look into this?
So here's what I'm going to do. Yep. So, so this is going to be usually passed off just like a Bobby would. Answer that. Make sure you have enough slack though. So here's your Bobby or Doppler. Got it. You just hook it up here. The Doppler machine is going to be there, so it'll be plugged in. So making sure that this is only to your field. So get a non-perforated towel clamp and make sure this is just clamped down, right? Non-perforated towel clamp. Go ahead. Don't clamp on the core, but just on in between so it holds it, right? Okay, so it's out of there. So at the very end of the case, we'll use this for check-in, right? So it's not going to go anywhere. It's at the very end of the case. Now your Bobby, I want to make sure that it's not in the way and the doctor can reach it or you can reach it. So I would pass off wherever the Bobby would be. Let's say hypothetically the Bobby's on that side. So start passing the suction or on that side. Start passing it that way and clamping it off so everything can be reached from that side. It's hammer day. Well, what do you have in your hand? No, I thought it was the ink error. Sorry. Where's the ink error? Yeah. Oh, it's in there. Okay. Go ahead. Hold it up. So what?
So where do I put this?
Good. So we want to make sure two things. We pass it off. Do we have enough slack? So we have these nice little things that we can put through. So do we have enough slack where we can come to the actual incisional vein? So that's all I care about. So I have a nice little thing here. You can actually push these through. If you want to get a little non-perforated towel clamp it to here. So then we can just put that right there, right? And then we have enough and it's not going to fall off. Like it's not going to be like, oh, we lost half of it, right? So we want to make sure we have enough slack that it's not falling out because you can't pull it back, right? So let me show you. What I'm talking about is I want you to, oops, apologize. Oh, that was my stomach. Minus my finger. So good. Do I have enough slack here? Right. It's good. It's good. I like this. Same with the suction, right? The suction is going to be, do you have enough slack, right? Hold this. You have another tower clamp? Yeah, no, that's it. That's all you have? Yeah. So do we have enough room here? That's fine. Good. Good. So if I ask for a Bovie, you can have room, gets put back in, ask for suction, gets room. Now, this is not the suction you would use. You would use that Pichon suction, which is over there. Glasses are falling. So let's do this. Are you ready? Because I want everyone to kind of try. If they saw the Mayo, you're going to come. Let's just say you go on that side for me, okay? Just so you're not in the way. You're done with this. You can come back here in case you need it. So I would ask you, anyone that wants to add to this, you all done a case study before. Okay. You did a case study before. Tell me a little bit about the anatomy. What about the anatomy?
I'm sorry,
I asked if you wanted to win the lottery ticket. Okay. So tell me a little bit about, you've all done a case study on this case. It's the carotid endarterectomy, right? So what is the anatomy involved?
The carotid artery.
3 things, right? Common carotid, internal carotid, external common, right? Internal, external, common. Okay. That is, if you ever do a case with a vascular person, they turn to you and you're doing this and you don't know that, and that's just the basic thing. Why are we doing this case?
To get black out of the.
There you go. That's perfect. All right, good. We're going to do this. Timeout. Give me a generic timeout.
The time is 8:25. The patient's name is Jim Bob Cooter. The procedure
Got some mess.
is a carotid endarterectomy. Virus. I'm blanking on one.
Anytime you're above the head, it's 1. Oh, no, it's 3. I apologize.
3.
3.
Virus is
sorry.
3. The patient
Delaney,
has
keep me in check, okay?
allergies. And antibiotic would be
2 grams of Ansep.
2 grams of Anacept.
Good. I agree. Everyone agree? What kind of local do we have?
Bladder with FU 1%.
Lidocaine, 1% Epic. Can I see how you wrote that, please? Lidocaine, Epi, 1%. Outstanding. Does everyone agree? Do we have everything we need?
Yes.
Good. So we're going to go with an 11 blade, please. Do you have a 10 blade loaded up first or no?
No.
Can you load a 10 blade up, please? Don't grab yours. Let her load it up. So, rule of thumb, obviously 11 blades for the artery. 10 blade is for the initial incision, right? And that's not your fault, Natalie. I didn't tell you. But you should get used to always having an initial 10 blade loaded, no matter what. It's just a good practice to be in, even if you don't use it. Right? You can have 2 Ratex. Okay, good. You're going to get as close as you can. I don't bite. Just be aware of the head there. So we're going to make an incision. Come on up. Can everyone see? Are you feeling okay? I'm worried about you. You sure? Okay. You need to sit down. Sit down. Is it? I know it's. Is it hot? Yeah, maybe it is.
There's something going on.
No worries, dear. Major incision. Can I have a Bovie, please? So you're in charge of Bovie and suction. So give me the Bovie. You're the assist. What do you need up here on Bovie and suction? So you kind of come up here. And if I lay it down, and you need to clean it off, you put it back, right? The initial, it's going to have a Adson with teeth to me and the assistant. So come on this side, like that. Actually, come on that side. Okay. And then I didn't want to use my other hand either. So as I'm coming down, you're following me, right? So just kind of grab on the edge and down. Can I have a mosquito, please, or a hemostat without suture boots? And just throw these down. Blade down, be careful. It's okay, just be calm. You don't have any, what did I ask for? Can I have a Kelly, anything? Please and thank you. So just say, "Coming your way, doctor." If you don't have it, if Frankie was a nurse, can I get some hemostats to the field, please? You need to. You can't just say, "I don't got it." Right? It's like, I understand you didn't have it on your field. So can I have the medicine bomb? So go ahead and grab this. Nope. Nope, got it. So all this is junk coming out. Can you cut that for me? That's a bomb. This is cut that. Where is that?
Would I just hand them to, would the nurse hand them to me, or would you just lay them on the table?
Well, if it's in a peel pack, you need to make sure you're doing it like you're doing anything else sterilely.
Okay.
Then you're just not laying it on the table. So I mean, you would open a pack, you would tell her, say, "Hey, can you grab it sterilely?" Right? You check the chemical indicator, right? Good. Lay that down. We're good. 2 Wheatlanders. My glasses are falling. Okay. Oh. So give me your Gerald Forset, please. Or your DeBakey Wannabe, the one that's blue. So that's a good example of tunnel vision, right? Are you having tunnel vision? Can you wear my glasses real quick?
Right above the knife handle.
Yeah, right above the knife handle. Oh.
No worries. I know this is so a good example of know what stuff that's on there and always keep it there, so you know it's okay. So when I said the anatomy, and obviously this is completely wrong. You're supposed to be going towards the head, so it'd be like this. But this is the only way I could do it. So the common carotid, internal, external. We're making that incision right here, right? We're going to put some vessel loops on that side. Vessel loops on that side control the actual bleeding. And we'll make the incision with the 11 blade. We'll take the plaque out. We'll irrigate it out. We'll probably put a shunt in first. Take that plaque out, put a shunt in first. But that's what we're going to be working on, okay? So when I ask for some things, make sure you put it back exactly where you want it so you know, okay? So we're going to go with some vessel loops. Do you have a right angle up there too? I forgot about that one. Right. So get a right angle or a mixer on there. That's garbage. Right angle. So I'll have a vessel loop. Actually, let me get that forcep back, please, and the right angle. Forcep to the, we'll call that the Gerald. Give that to the assist. Can I get a right angle? And I want you to lay the vessel loop right here. Okay. Grab it. It's going to be a little wet. It's fine. Okay. Then you're going to grab the tip of it. And you're going to come over here. We're going to control this vessel. Good. And then as I get it halfway, and your job is to make sure this doesn't get caught up on stuff. If you see it, help me out because that's my first day. So are we halfway? All right, so now I want you to grab that tip. No, grab this tip. And I want to do it again. We'll come back under. So let's try one more time. Bradley is so confident in my effort. Grab this one. No. That's this one, right?
I just grabbed
Alright, that's the one. Oh, shit. You might want to not hire me as your surgeon. Alright, good. Can I have a tie on it with some suture boots since you don't have any? I'm sorry. Can I have mosquitoes with some suture boots or a stat or yeah? There you go. Okay. All right, we're going to do that again. Vessel loop. My nose is running. Come here. We learned our lesson. Which one you grabbing? Okay.
Man, I was ready to grab.
Go. You'd be a good assist. Especially here. Yeah, go. Another mosquito. Good. And we're going to do the Ramel hook. Excuse me, I'm sorry. I'm just not want to be snot coming out my nose while you're watching. Romeo hook, please. So I'll have the umbilical tape. Same way. Same principle. Give the hook to the assist, please. You're going to hook it, lay that down, you're fine. Hook the very top of that, and then push one of the red things on it, as close as you can to the top. Alright, push it on there, you're good. Keep on, keep going. I got it. Unhook it. Do you have another hemostat or no? We're done here. Do you have a mosquito, anything that's something? Good. Alright, good. Outstanding, we're done with that. Alright, 11 blade. Incision. I'm not going to cut into it because it won't. Scissors down. Anesthesia, can you give heparin, please? And that's going to thin the blood out. Alright, so we need to control this bleeding. Heparin's in. Alright, so can I get some heparin saline solution real quick? Okay. Irrigate now. Pot scissors. Extending that incision. Can I do it? I don't want to ruin it. Extended. Good. Can I get the Javits shunt? We're going to control these. These are good. Control. We're going to open the flow up. Can I get the Javits first? Can I get a selection of Javits? Just bring them all up. I'll choose.
Laying down.
Yeah, typically what I'll do is say, doctor, which one would you like? Sometimes he likes these certain ones, if he likes this one, and put the other ones back, right? If you're not sure, just bring them all up. All right. Can I have the Javits shunt clamp? It's going in one side, going in. Can I go in here? No, it's not. Let's just say it's in that way. And in this way. Clamp. Controlling it. All right, can I have the pot scissors one more time? Good. Extend that a little bit more. Bifurcation is where the plaque is, or technically we're coming this way. It's reversed. It's supposed to be this way, so you're coming up. Bifurcation. Good. Can I have the Dennis Mills forceps? In your back table. Forgot to put it up. Good. That's how you pass. Like a pencil, right? Right, just like that. Right? So I hand it to you. Let's say you're asking for a forceps. Just like that. So hold it like a pencil, not like, take it. Take it. So pass it like a pencil, right? There you go. Perfect. Stripping off some stuff. We're done with that. So you're going to have a tie on a passer, please, and a right angle. Right angle to the assist. I'm going to come on here, so come underneath this way. So when I say just come underneath, and I can just grab it for me. Good. So what do you need? Now, what do you think you need? Wow, these were short, Bradley. What do you think you need if I tie off a vessel, Natalie? What type of scissors? Scissors?
Straight.
Can I get a free tie? We're going to take this clamp off. Take that clamp off. We're done with the Javits shunt. Free tie. So have you given someone a free tie before? I'm going to hold my hand like this. But I want you to just take it out. Just go like this and just go like this. And I'm just going to grab it, okay? Or you hold your hand out like that. So just come on over like that. Okay. I say free tie. Yep. Make a habit of staying over your field. Even though I know it's a little awkward, but if you're like over here, things can fall. So doctors typically go like that. You just make a habit of trying to come in this way. In a perfect world, maybe you had your setup on that side. But I've seen most cases that are like this from this side, this angle. You need to back up a little bit. Okay. Forceps, the Bakey or the Gerald. Let's take all this off real quick. Right angle under here. Load this up on a free tie for me. Here it is here. Quick, brief. I need a tie and a passer, please. Is that the Schnitz? That's fine. I'll take it. Good. Good job, Natalie. Grab it. Grab it. Like clamps. What's coming my way? Yep. All right, we'll take all these off. And who wants to do this? Anyone want to practice? Realistically, you got an idea of how this is all going, right? Another thing, here's another thing. If you don't have, I didn't show you, if you didn't have heparin irrigation in a syringe or a asepto syringe, in that scenario, when he's trying to tie something off, he's going to hold his hand out. Not because he wants to shake your hand. He wants you to squirt a little bit of that in his hand. And he's going to go like that. Why is that? He's dealing with a lot of blood. And so it really helps him with not sticking, especially if he's tying off something. So typically when he's suturing like Proline and all that, when he's ready to tie, he'll go like this. And I'm not saying a ton of irrigation, just enough down there, squeeze, 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 right? So let's take all these off so we can show everyone. So set that up again. You remember how to set up? Does anyone want to play Natalie's role? Delaney, are you tired? What time is it? Is it too much?
11:45.
No, it's just like, it's cool, but I'm still like trying to process it.
I know. I'm a believer in it will all come. But do you get the idea of vessel loops?
Yes.
And that's half the battle. Can you listen to the doctor?
Yes.
Okay. All that will come in time.
Maybe. I'm kind of done.
May I ask a question?
So am I, but I got it. So you can get it. Never a dumb question. Put that on the Ramel.
How am I knowing,
We're gonna
as a
stop.
search check, how am I knowing what I'm handling?
Like, what was their concern that you just did?
Are they gonna say? Hand that
A
to
nice
you?
one would. Are the assists? There's hand signals. What's that?
Scissors?
What's this?
Force knives?
Okay, what's this?
Scalpel? Tie? Retract.
Suture. So suture could be like this. Now it's your job to know what type of suture or scissors you might need. If it's he's sewing in a suture, right? You should know it's a straight Mayo. If he goes like this and he's kind of around the delicate skin, you probably should give him a medicine balm. Now in the beginning, when you're externships, I would say you're not your first week. They're going to throw you in a case like this, but if you are within a couple weeks, how I did it was I'll stand on that side and I'll let you think it through about 3 seconds, and eventually I'll go like
So that's like the preceptor.
preceptor. You're never ever by yourself, all by yourself playing, flopping around like a fish, right?
Oh, God. So the externs will never be.
No, you're never by yourself. So everyone take a deep breath. Don't go quitting them, because Chrissy says I throw too much at you. But I know you can handle all this. It's just about exposure. So if I'm with you, right, if I'm your preceptor, I'm like, left blade. But I was always trained, I don't want to quickly, I'll let you think it through a little bit, because that's a good way to process it. If you don't get it,
Was this here or? I like to think about it for like 3 seconds.
but not everyone do that. They're like, you should know that. You should know that. You just go with it, right? It's okay. You learn. Every case, the first case you do, you learn probably 5%, right? That was a blur. Second case you do, okay, maybe 15. It's progression. The progression is what is going to get better at. We're doing these cases over and over. By the way, I love the way that's set up. That's how I would do it. Let's break down. It's almost time to go. No, we're going to get there. Did you like this at all? Or
I love this.
because my old way was just to do basic boring stuff over and over until you throw up.
It's better to get hands on. Like,
Yeah, and we have more time, and it's getting hot, and we were fighting that. But
you did good, Natalie. Good job. Yes.
awesome. Take those earrings out, rip them out. You're not gonna wear these at externship, are you? Okay. So let's help her down, or help her down off the ledge. Now help her break down, and Brad needs a break too, evidently. I have to. Here, before I go, I want to sew my thing. I'm going to sew this back up for Friday. Who wants to help me sew this up?
I don't know how.
I'm going to sew. Just who wants to help me? Can I get this?
Yeah.
This?
Then I gotta put that. It's okay.
No one wants to help me. All right. You're free for a break, but I'm going to sew this up before I break it down.
And the ones that we put the booties on, didn't we pull
Yeah,
that from?
these.
So all these vascular supplies, lay them on the over on the front table there. I need to make sure it's ready to go for Friday.
Non-perforating, how many did you have?
There's some up
Only
here.
two. Okay. Just wanna make sure I put the
Yeah.
ones back.
And I just get an adson with teeth and a scissors, and I'll be all right. If someone wants to help me, that's fine. If not, it's good.
I'll help you in my hand.
Did I just wrap these loops back on, or am I tossing them?
No, I need those. Just lay it up at the table. I'm gonna repurpose everything, and because Chrissy will kill me if I start throwing things away. Where's mine? Oh yeah, there's. She can get the scissors. Interesting. I never put the IO-band on here before. I don't know what's gonna come on. Or just cut that.
Cut this right here?
Yep, go down, cut. So when you're cutting, don't come all the way in like that. Just kind of come with your tips and then turn. Because you can actually come through by accident, cut the other side skin. All right, so we got our anchor.
So come in.
Yes.
So hold this. When I say follow, just kind of hold that out, but don't pull on it too much. And when I come through, you feel a little tension, just let go.
This is yours. This is yours.
Delicate. It's a delicate skin. There we go. That's fine. Beautiful. Maybe hold that. Let go. That. Hold that. It's looking good. Even though this is fake skin. What I look for is alignment. So it's called, you want these inverted up like that. That's going to prevent scarring. So if this is not lined up and it's not inverted, it has these little scars, and people hate scars. Not to mention this is going in between the dermis, but I'm not doing it all the way because this is like pretty foam. It is foam. So I kind of go where it can grab onto. The whole idea is to get it in between the dermis so you don't see it. And then just pull on as you're closing. Sometimes you can hold it together, but see how it's not very pliable.
Yeah.
Most normal skin kind of goes together really good, especially if there's blood or something.
If it's given before they're fully in, you should just kind of go a little bit closer with the string. Scissor.
Say one more time.
So like like how you weren't fully going underneath, so I
Yeah.
kind of went a little bit closer. Is that fine to just kind of
If that was skin, obviously I just broke it down. But if that was skin, I want to try to get. There's dermis, there's the epidermis, and then there's that subcutaneous layer. You want to try to get in the subcutaneous layer. It's thick and tough. There is no layer there. I'm just trying to get it where, because if I went deeper in there, it's just going to tear as I pull it.
Yeah.
So I just want to close it one for tomorrow or for Friday. So let's do it one more time because. And I've never done it with the IO band on it. Typically, that's not what you would do. You would tear the IO band off the skin, but I don't think it's coming off the foam. I ruined my demo. I've had it for 3 years. My demo's ruined. For you guys.
Thanks.
I just got my breath.
So it's just up here.
Okay.
And last but not least, we're done.
I just haven't grabbed it.
Yeah, that's fine. I'll find something to do.
I'll tell you cut it in a minute.
One thing at a time.
Oh, that sucks. Here, cut that right there.
Excuse me.
I haven't did this closure in like 2 years.
This
It's alright.
today, right?
Not supposed to do this, but whatever. So what that does is buries the knot. Come through, you're supposed to pull on it and it buries it. But since I had a nasty knot there, that's terrible for any kind of suture closure because that causes scarring and people itch like crazy. But you're supposed to bury this with that and it tucks it in. So just cut right there. There we go. Not bad. Suture, done. Take it off. So again, anything vascular, lay it on that table for me. I appreciate it. And if you need to take a break, we're almost. There is no break. We're almost done.
Sizing what?
No, you can throw them away.